Hello everyone, today we are going to study about what is preload and what is afterload and what is the main difference between them. As it is a quite simple topic if you once understand it, but it is sometimes very tricky and it can confuse you up to an extent. So I'll try to explain in a very simple way in this video. So what is preload? Preload is the volume of the blood in the ventricle at the end of the diastolic, that is the end diastolic volume. As we know that our heart has two cycles, one is diastole and another is systole. So during diastole, the both atrium will contract and send the blood to the ventricles, or we can say it is the time period during which the ventricles fills their blood, and during systole the both ventricles will contract and send the blood to the aortic or pulmonary circulation. So what is preload? Preload is the volume of the blood in the ventricle at the end of the diastole, that is end diastolic volume. So the volume that is present in the left ventricle at the end of the diastole, so this volume of the blood will be applying some pressure in the ventricular walls. So this volume of the blood is known as preload, or we can say the amount of blood present in the ventricles just before the contraction. So this is all about preload. What is afterload? So afterload is the pressure required to overcome the blood pressure in the aorta. So when during systole, when the systole starts, this aortic wall will be opened, so there will be some pressure of the blood that will be pushing itself towards the left ventricle, but the blood present in the left ventricle will have to apply a force, or you can say a pressure. So this pressure which is need to overcome the blood pressure in the aorta, this pressure we can say it is as afterload. So it is the pressure required to open the aortic valve. So this is the main difference between preload and afterload. So but why they are important? Because our heart stroke volume is dependent on both of them. So stroke volume is the volume of the blood that is pumped out of the heart per beat. So during a single beat when the heart pumps out the blood, that volume is known as stroke volume. So it is roughly around 60 to 100 ml per beat. So stroke volume is dependent on these three factors: contraction of the ventricles, the contractibility of the ventricles, second the preload, and third the afterload. So this is a small video about preload and afterload, and I hope you guys understand it quite well. Thank you.